Hello students, in this YouTube video, you will have the opportunity to learn about oral cholangiography, its purpose, and much more. I encourage you to tune in and watch this informative content to expand your knowledge on the subject. So grab your seat, get ready to learn.
Hello everyone. Today I am going to explain about intravenous cholangiography. The term cholangiography, which refers to the spatial radiographic examination of the gallbladder. So today we will discuss about intravenous cholangiography. We will discuss about its full procedure, indication, contraindication, as well as patient care also. So, what is intravenous cholangiography? Cholangiography is actually a diagnostic imaging procedure used to assess biliary duct, right? So, as you know, that biliary ducts are responsible for supplying bile to the gallbladder as well as to the duodenal region, and it helps for the process of digestion of fat. But sometime, due to any anomaly, due to obstruction of bone, due to obstruction of duct, sorry, slip of tongue, due to obstruction of duct, when adequate amount of bile do not enters into the duodenum, then patient gets several type of problem. Number one, indigestion of the fat. On another hand side, cholangiography is not only examination to detect the obstruction, rather it is also used to detect several other anomaly related to gallbladder and duct, like cholecystitis, cholelithiasis. Cholecystitis is the condition in which wall of the gallbladder get thickened. Okay, so what is written over here? Intravenous cholangiography involves the use of contrast agent that is injected into the patient vein to highlight the bile duct during imaging. But one thing I would like to say, that beside intravenous cholangiography, there is one more examination which is known as oral cholecystography, and that examination also provides same image. We position patient in same way. So, why we do intravenous cholangiography if we can do oral cholecystography? Then the answer is, if a patient having abnormality of the digestive system, malabsorption, he cannot able to digest or absorb the contrast medium, then how it will enter into the blood? So it will be not possible to visualize the gallbladder and biliary duct. So there is another provision, alternative method, that is intravenous cholangiography, in which contrast agent is directly injected into the blood vessel. Okay. Now, introduction. Intravenous cholangiography is valuable diagnostic tool for evaluating disease or condition affecting bile duct, gallstone, tumor, stricture. Do you know what is stricture? Stricture means narrowing of the duct. When bile duct get narrow, then bile, then there will be problem. Patient will suffer from problem, either he or she will not receive adequate amount of bile into the duodenum, to the region of duodenum. So this examination helps doctor to accurate diagnose and plan appropriate treatment. Now, indication, what are the condition for which this examination is done? Number one, suspected gallstone. Suspected gallstone is also said as suspected cholelithiasis. Another one is jaundice. It is not possible to identify jaundice by means of this examination, but jaundice may happen due to obstruction of the common bile duct. So, if we will see there is an obstruction in the bile duct, then we consider that this jaundice is obstructive jaundice. So, for confirmation, है ना, we get appropriate idea, reason and cause of the jaundice there, whether patient having obstructive jaundice or non-obstructive jaundice. Number 3, unexplained upper abdominal pain. Number 4, abnormal liver function test. So, in such condition, indicated, indicated, but abnormal liver function test. If a person having abnormal liver function test, then this examination will be counted in the category of contraindication. If a person liver is not healthy, then contrast agent will make the situation more worst. So instead of writing abnormal, we have to write here normal, normal, normal liver function test, but comma suspected TB or bile duct related disease. Okay, that is mentioned just below. Disease. Spelling is correct. Okay. Suspected bile duct obstruction or narrowing. Okay. Now, contraindication, in which cases intravenous cholangiography is not done. We do not consider to do this examination. If any patient having problem or case is contraindicated, then what is the method, how we will ensure that he or she is suffering from particular GB related disease. Then there is one more option, that is non-invasive procedure of ultrasound. Ultrasound is one of the best modality by the help of which we can able to detect any type of abnormality related to gallbladder or biliary duct. So don't worry if a person having any allergy or any contraindicated condition, then we should send for ultrasonography. Okay. Intravenous cholangiography may not be suitable for patient in certain medical condition like allergy to the contrast agent, severe kidney impairment or kidney failure. लेकिन first question, the question is that how a radiographer able to understand that his patient having allergy to contrast agent. This can be confirmed by taking certain history of the patient regarding allergy to the smoke, allergy to any food item like fish, है ना, or allergy to penicillin or any drugs. In such condition, we consider that it may be possible that he may suffer from allergy, because what happened in case of allergy, if a patient is very sensitive, uh, then histamine will uh, create problem. Okay. And he will show the condition of allergy, but in rare cases we find such of type of situation. But many people have are very sensitive, है ना? Their mast cells secrete more histamines, and this cause allergy. Okay. Now, severe kidney impairment or kidney failure. In this condition also, we have to send for LFT test. We have to send for kidney function test in case patient having liver function test impropriate, not correct, है ना? We consider, we put in contraindicated condition. Okay. Another method is that you have to send for some other test also like CT, BT, and a clotting time and bleeding time. If such condition, that condition is also not in normal range, then we do not consider this examination. After all, we have to inject the contrast agent via vein. And if a patient having kidney impairment, है ना, like increase in creatinine level, that is metabolic waste of the muscle, in such condition also this examination is not allowed, because this may cause more problem to the kidney. Okay. However, contrast agent, maximum contrast agent is excreted from the liver, not from kidney, because this examination we use ionic contrast agent, and ionic contrast agent is lipophilic, not hydrophilic. It dissolve with the lipid, but but little percentage of the contrast agent get excreted from the kidney. And in such condition, if a person having the problem of kidney failure or any type of abnormality like nephropathy, in such condition what happens, that contrast agent will easily able to enter and pass through the kidney and across the glomerulus. In such condition also, patient kidney condition will become more worse, oh, vast. Okay. Now next is the pregnancy. If a patient is having is conceived or having a baby, है ना, inside the womb, in such condition also this examination is contraindicated because radiation cause hazard. Okay. Severe systemic illness that could worsen the contrast agent. Now, equipment required. What type of radiographic equipment is necessary for this type of examination? Number one, X-ray machine. Number two, fluoroscopy. Number three, what you need? You need intravenous catheter to inject the contrast agent. Number four, you need water soluble iodine based contrast agent. No, you need lipid soluble. Okay. Lipid लिपिड सॉल्युबल आयोडीन बेस्ड कॉन्ट्रास्ट एजेंट, ठीक है, means ionic contrast agent, a syringe, other necessary accessories, monitoring equipment to assess the patient vital sign. Okay, contrast agent intravenous. What type of contrast agent we require for intravenous cholangiography? So what we will do, we will put here lipid soluble, लिपिड soluble iodine based contrast agent है ना. लिपिड soluble contrast agent are ionic contrast agent. Okay, it contains ions है ना, not non ionic type. However, water soluble contrast agent are non ionic type of contrast agent. Okay, patient preparation. So we have to put one more thing over here in contraindication, uh, here. Okay, control C and control B. Okay, this is 5 number. We have to write severe na, hepatic na, hepatic disease. Okay, and how we will get information by liver function test. Okay, so LFT is very necessary. Patient preparation, patient should have fasting and maybe asked not to eat drink. Medication, inform the healthcare team about any medication allergy, medical condition. Okay, and blood test is very necessary, like kidney function test, kidney function, comma, liver function, comma, CT है ना, EP है ना, PTCT, before administering the contrast agent. Full procedure. The intravenous cholangiography procedure generally involves the following steps. The patient is positioned on the X-ray table. Intravenous catheter is inserted into the patient vein, usually in the arm of hand, है ना, as we do intravenous pyelography. Similar method of injecting the contrast agent. You have to puncture the vein, not the artery. The contrast agent or contrast medium flow through the bloodstream and accumulate in the bile duct. है ना? Multiple X-ray images are taken using fluoroscope to visualize the bile duct and any potential abnormality which can be easily is seen है ना, in the fluoroscopy. The procedure usually takes around 30 minutes to an hour depending on the complexity of the finding. Aftercare. After the procedure, patients are generally monitored for short period to ensure there are no immediate adverse reaction. What type of adverse reaction you will find in the patient if he or she get a reaction due to this contrast agent? Certain type of, like flushing of face, tachycardia, or bradycardia, or urticaria. Urticaria means red color patches on the skin, है ना? Several type of things you will observe and you will able to understand, yes, she is suffering from she or he is suffering from allergic condition. In such condition, you have just to inject anti-allergic drug. Okay, so in for emergency, we keep such type of drug in the radiology department. In some cases, patient might be asked to drink plenty of fluid to help flush out the contrast material. It is important to note that specific protocol and practices may vary among medical institutions. Additionally, Any medical procedure should be performed by trained radiographer. Okay, radiographer, radio, radiographer professional following appropriate indication and guideline. Always consult qualified healthcare provider for personalized information and guidelines. ओके, थैंक यू, धन्यवाद। और इसके साथ ही हम लोगों ने 20 मिनट में सारा समापन कर दिया। ठीक है, ओके।